Good afternoon. Pansy the Answer Dog and I are going to do our Camtasia for Osteology, Quiz 6. And we're actually going to split it into two pieces because it's rather long. So we'll do about 95 or so slides in the first part, part 1, and then there'll be a second Camtasia for part 2. This is part 1. Pansy's pretty excited, and she is ready to go because bones are one of her favorite subjects. Here we are. So, the skeletal system has 5 functions. Let's see if Pansy has any of them. Right. Support. Okay. Right. Protection. Movement. Oh my God, she got this one too. She was rolling her eyes. Production of red blood cells, white blood cells, and platelets. This is where those cells are produced. With the exception, there are some white blood cells produced out in the lymphatic tissues, but they all begin in the bones and no, not food. What's the other one? Okay, right. Storage of calcium and phosphate, and also we store fat in the bones, in the bone marrow. So what we'll do is address each of these functions in turn. We'll start with support. So the support we're talking about here is support against gravity. So when human beings stand up on 2 appendages, they lock their knees, and the majority of the work that's being done is really done passively by the bones. The bones don't have to expend any energy to support our weight against gravity. The muscles do have to be involved to keep the bones in the appropriate positions, but the bones do this sort of free of charge. The bones also give our body shape and form. Now, for human beings, quite honestly, body shape is mostly aesthetics. Humans on their own don't go fast enough to make wind resistance a really big deal. Some animals do, and some animals swim fast enough to make their drag in the water a really big deal. Humans don't, even Michael Phelps. So shape and form are mostly just aesthetics. Protection. So the protection is really protection against minor trauma. If you get hit by a truck and it's going quickly, your bones aren't going to really make much difference. But for minor trauma, they do help. And we'll address this further when we get a little bit deeper into this subject. Movement. So this is kind of curious because I went down to the lab. I thought, I really don't want to be lying to these people, so I need to be able to demonstrate this stuff for them. So I went down to the lab, and I got out some bones, I put them on the table, and I watched them for 3 hours, and they never moved. Pansy's rolling her eyes again. They don't move, not on their own. But what they do is get involved with movement by their association with muscles. And muscles are going to be the topic 7 material. So there are really 2 parts. One part is that muscles attach to bones, and the other part is that muscles function as lever systems. And we'll elaborate on that a little bit as we go along. I think that the production of the cells, red blood cells, white blood cells, and platelets, those are very important things. And we talked about red blood cells and white blood cells and platelets back when we talked about connective tissue. I think this is pretty self-explanatory. There's no magic here. This is where these cells are produced. And then the storage of calcium and phosphates. Both calcium and phosphate are important for our physiology. And bones have 2 possible functions with respect to them. They can be a source of calcium and phosphates if there's a deficiency. This happens sometimes during pregnancy, especially if a female is both pregnant and lactating at the same time. A lot of calcium is being released through the milk and also in the formation of bones within the fetus. So if she doesn't have an adequate supply in her diet, the bones can decalcify, and the calcium can become the source of the materials she needs. It also, the bones are a way of getting rid of the calcium or phosphate if you have too much. So it becomes not only a source, but it becomes a sink. So if you have too much of this, more calcification occurs on the bones, and you get the concentrations in the blood down to acceptable levels. The storage of fat is also very important. We store fat in a variety of locations throughout the body. You find fat in the yellow bone marrow, and so bones do have that, and Pansy especially is fond of that. So the skeletal system has 3 attributes, and these attributes make the bones better at those functions than any other organ. So let's see if we can come up with the attribute. Pansy is looking very attentively. One would be, right, the material. Another, right, the shape. And the last would be, right, position. Okay, so we will address each of these in turn as well. We'll start with the material. So the material is hard and rigid. Hard and rigid is important for support against gravity. If our bones were made out of well-baked lasagna noodles, they wouldn't be very supportive. Protection, again, if you had lasagna noodles that were well-baked and they made your skull, the skull wouldn't be very protective of the brain. And lastly, the movement. If we had, for example, a humerus that was made out of ziti or fettuccine or something of that sort, it would not be a very good place for muscles to attach and pull on, nor would it form a very good lever system. So, some of you may remember that at the beginning of the course, I said that I would not talk about intelligent design because there was no evidence of intelligent design. Well, it turns out that's not entirely true. And some of you may have an idea of what the name was of the first male. And so Pansy even knows that one. No. Well, okay, we'll try that one. Adam. It turns out, though, that Adam wasn't really the first male. The first male was Pasta Pete. And his remains have just recently been unearthed in Rome under a pizzeria when they were doing some excavation for some project they had going on. So here are the skeletal remains of the first man, Pasta Pete. Oh my God, look at this. So Pasta Pete, instead of having vertebrae like current human beings do, he had lasagna for vertebrae, and he had rotelli ribs, and he had elbow macaroni for a pelvis. And if you think about it, having a elbow in your pelvis is kind of weird. Look at his noodle for protecting his brain. Oh my God, it was a ziti frontal bone. Not too smart there. Lasagna for maxillary bone and for a mandible, and you can see he had little unis for teeth, bow ties for an orbit. Look at this, his upper limb. This is ridiculous. He had ziti phalanges, he had ziti for a humerus, and he had fettuccine ulna and radius. Pasta Pete did not work out, and the intelligent designers who designed him were so embarrassed at what a disaster he was that they just buried his skeletal remains and never wrote it up in the Bible, and they just started with Adam. So there you have it. That's the only evidence you're ever going to see for intelligent design. Pansy's covering her head. Okay, so bones come in 5 shapes. This is from page 103 of the Matter Anatomy and Physiology book. We have long bones. Long bones are longer than they are wide. The example I gave here is a humerus. We have short bones. Short bones sometimes are sort of cube-shaped, not exactly cube, but sort of. This would be a talus. That would be your ankle bone. Some bones are flat. And here we have the temporal bone. Temporal bone of the skull is relatively flat. Another one that I'm pretty sure you'll be studying in lab would be the scapula. Irregular bones. Regular bones have a variety of shapes. Here we have a cervical vertebra. We can tell it's cervical because it has transverse foramina over here. Probably one of the more inferior cervical vertebrae because it doesn't have a bifid spinous process. You might wonder, why does it have all of these irregularities? The irregularities often are caused by muscle attachment. We have round bones, which have a circular shape. And one example of a round bone, there are not a lot of round bones, but the patella. Patella is also a sesamoid bone, suggesting that it was not in your body when you were born. Okay, so flat surfaces tend to be really good for protection or for traction of muscles. And I mentioned the scapula. In the case of the scapula, the flattened surface mostly beneficial for muscle attachment. In the case of the temporal bone, mostly for protection. We have long bones. Long bones make really good lever systems, and they are good at supporting us against gravity. So the femur, the tibia, the fibula of the lower appendage, and the humerus, the radius, and the ulna of the upper appendage are long bones. And if you were to use 4 appendages to support yourself, those long bones make really good supports. Cube-shaped bones, equal in length and width. I mentioned one that we had in this PowerPoint was the talus, the ankle bone, and we're going to see that it sort of forms a very specific and specialized joint in the ankle. So here's a flattened bone, the scapula. We're looking at the deep side. This would be a left scapula. The humerus would go here. And this big surface is where muscle attaches almost to the entire surface, and that would be the subscapularis. Here's a long bone, the humerus, and here's the head that goes to the glenoid cavity of the scapula, and the medial epicondyle, lateral epicondyle. This would be the trochlea that goes to the trochlear notch of the ulna, and over here is the capitulum, which goes to the head of the radius. Here we have the cube-shaped bone, and I mentioned this is going to be about as long as it is wide. This fits in between the tibia and the fibula and the ankle joint, and then also articulates with the bones of the foot. And then we have irregular bones. Here we have a thoracic vertebra. I can tell that it's thoracic because it has superior and inferior costal demifacets. It has a transverse costal facet and then articular facets and a long spinous process which points inferiorly. Those are all the demifacets, the transverse costal facet, and a long pointy spinous process all are characteristics of the thoracic vertebrae. There's the superior articular facet, transverse costal facet, inferior costal demifacet. What does demi mean? Anybody know? Right, half. So it's half of a facet. And what happens is the head of the rib comes in and articulates right here, and half of the rib's head touches here, and half touches on the inferior demifacet of the vertebra superior to this one. Here's a round bone, the patella. Remember the patella is a sesamoid bone, and it forms after birth. Okay. So the position. There are several parts of the position that are important. One is the position within the body, what it is relative to other parts of the body. And then the other part of the position that's really important is how the bone is positioned relative to other bones. So all of these are important for support. And so, for example, the femur, the tibia, and the fibula to support a human need to be lined up underneath the person's body, and generally that's the case. For protection, the position of the bones of the skull will be very important for protection because they're superficial to the brain and prevent the brain from receiving physical blows. And then movement, the arrangement of the lever, the bones of the lever systems, and also the attachments of the muscles to the bones allow for movement. So another couple of things. We have the arch of the foot. The arch of the foot actually sort of works like a shock absorber and it takes some of the impact out when you land on your feet, if you're moving along, especially if you're running or jumping. The vertebral curves are beneficial for shock absorbing and also for flexibility and movement. We'll talk about that. Okay, so what's the difference between bone and a bone? Right, bone is a tissue. It's one of the major types of connective tissue. Remember, there was bone, cartilage, blood, and connective tissue proper. And a bone is an organ. Very good. Okay, and that would be like the humerus. So remember, bones is one of the 4 major connective tissue types, and it has a lot of intercellular matrix, and that's one of the characteristics that connective tissue has. A lot of intercellular matrix and not a lot of cells. And if you remember back to when we talked about connective tissue, the advantage of having not very many cells is that it's relatively low maintenance in terms of oxygen, energy requirements, and waste products. That's the good news. The bad news about not having very many cells is that it doesn't heal as quickly as other tissue types. So when people tear an ACL or their Achilles tendon or something, it may be the best part of a year before they recover from that. Okay, so there are going to be 3 major components in bone tissue, and one is going to be hydroxyapatite. Hydroxyapatite is a mineral. It's hard. Okay, we have 5 calcium, 3 phosphates, and a hydroxide. And that hydroxide thing we're going to talk about when we talk about teeth. Okay, we have bone collagen. Bone collagen is a protein produced by the cells, and this stabilizes the mineral and makes it stronger than it would be if it were just the mineral alone. And then lastly, we have the cells. And the mature cells, the mature bone cells, are called osteocytes. The osteocytes actually come from a type of bone called osteoblasts. Osteoblasts are able to create new bone tissue, and then eventually those osteoblasts become surrounded by the intercellular matrix and they get a new name called osteocytes. There's another kind of cell called an osteoclast, and osteoclasts are actually able to remove bone tissue, and we'll talk more about that eventually here. So in a bone, normally the hydroxyapatite is going to be about 65% of the bone mass, roughly 2/3. Okay, and here is a drawing from a microscope slide of bone tissue. So we have the osteocytes, we have the bone collagen, the protein fibers, and then most of what you see is hydroxyapatite, the mineral. It's funny because I've had a lot of students, usually the students that aren't studying enough, tell me that when they look at bone tissue they think that they see a face. I'm not really sure what that's up with. All of the good students, they never report such a sighting. Okay, so bone collagen is going to function in stabilizing the bone matrix. I've tried, as we go through here, when we hit functions, I try to put them in red for you. The osteocytes are going to surround these channels called Haversian canals or blood channels. Sometimes they're even called nutrient foramina, and those are the tubes through which the blood passes. So there are these little canals that come from the lacuna where the osteocyte lives, and those little canals extend down to the proximity of the blood in the Haversian canals, and this allows the cells to get access to the blood for exchange, for picking up oxygen and nutrients, and getting rid of carbon dioxide and waste products. In addition, the canaliculi are also important for connecting cells to each other, and that allows them to interact with each other. So canal, right, is a canal, and iculus is something small, diminutive, so this just means little canal. There are going to be 4 types of cells, and they help maintain and repair the bone tissue. There's quite a bit more detail about those in the Quiz 4 PowerPoint, which we finished some time ago. So here is a lacuna with an osteocyte in it, and then we have a canaliculus, little canal extending down to the Haversian canal. And the Haversian canal or central canal or blood channel or nutrient foramen, that's where the blood passes through, and these canaliculi allow extensions of the cell to get close to that, to get their supplies or whatever they need oxygen, glucose, things like that, and get rid of waste products. Okay, here's a coronal section through a long bone. We have the epiphysis at one end. There's an epiphyseal cartilage. Then there's the diaphysis in the middle, another epiphyseal cartilage, and then an epiphysis at the other end. Okay, so really three distinct parts of bones. And this is not just long bones. This is a long bone, obviously, in this picture, but I can show you vertebrae, irregularly shaped bones that have these same three parts. So here we're looking at the distal end of the leg. We have the diaphysis of the tibia. We have the epiphyseal cartilage and the epiphysis of the tibia. Okay. Oh, let me go back just a second here. This is the talus, the ankle bone that we were talking about, and this is the distal end of the fibula. The fibula is going to be on the lateral side. Remember, L for lateral. Okay, so each of the bones is going to have two epiphyses and one diaphysis. And if you look at these words to see what they mean, epiphysis means to grow upon, and diaphysis means to grow across. So that sort of makes a certain amount of sense. Okay. The epiphyseal cartilage, or epiphyseal plate, or sometimes the growth plate, is where the bone grows longer. There's going to be one of these at each end. And occasionally little kids, before these plates have sealed off, break their bones right near the epiphyseal cartilage or epiphyseal plate. And when that happens, sometimes the epiphysis and diaphysis fuse together and movement is no longer possible. So, as a person gets older, a couple things happen. As you approach puberty, the sex hormones start to be produced in greater amounts by the gonads, and this causes a couple of things. One is, in boys, the brains stop working, but in both males and females, the epiphyseal cartilage becomes bone. The two pieces fuse together, and long bone growth stops. Okay, and at that point, there are different names for it. Some people would call it an epiphyseal line or an epiphyseal scar. I'm not really hung up greatly on what you call it at that point. Okay, we have spongy bone. Spongy bone, named for a famous anatomist who later got a show on TV, Spongy Bob. Spongy bone also is called spongy bone because it looks like a sponge. Who would have thunk, right? And then we have the endosteum. Now, the endosteum is connective tissue. It's a connective tissue membrane on the in the middle of the bone where it's hollow, and the endosteum has some similarities with the periosteum. There are going to be bones associated with the endosteum called osteoclasts that are able to actually erode bone tissue on the inside. In addition to spongy bone at the ends of the bone, and by the way, the spongy bone is produced by the epiphyseal cartilage, in the middle part of the bone there's compact bone, and compact bone does not have vacuous openings all through it. It's really solid looking. And the compact bone is produced by the periosteum, by osteoblasts. And then we have the medullary canal. The medullary canal is the space that is surrounded by the endosteum. Sometimes the medullary canal is called the medullary cavity or the marrow cavity, and this is where we would find yellow bone marrow. Okay, so the epiphysis of both of them, the epiphyses are going to contain the spongy bone, and spongy bone is going to be covered by a thin layer of compact bone, and we'll actually see a picture of that. Okay, and then the compact bone is covered by articular cartilage. Now you might think that the spongy bone is not very strong because it looks like it's got all these spaces in it. It actually turns out that it is quite strong. Okay, then we have the endosteum. The endosteum is going to erode the matrix of the bone tissue and make the medullary canal larger as the bone gets bigger, both in length and diameter. And so you might think, well, gee, this stuff is mineral. How does it do that? It uses acid So teeth are subject to damage by acid because hydroxyapatite, which is found in the teeth, dissolves in acid. Same thing with bones. And so the advantage here is that the bone can get larger and the bone will still be more hollow and lighter. The bone cells that do that erosion are called osteoclasts. Okay, so what would be the advantage, Pans? Right. Oops, sorry. One advantage is that it's going to be lighter, and lighter means it's going to be faster. And the other advantage? Right. Tubes are stronger than solid rods of the same amount of mass and the same material. So by having a tube, you have a stronger structure and a lighter structure. Both of those are advantageous for speed. Also, the osteoclasts can actually form callus on the marrow cavity of the bone. I'm sorry, the osteoblasts form the callus on in the marrow cavity of the bone when a bone is broken. And we'll see this callus not only forms on the inside, but also forms on the outside. So osteoblasts forming new bone tissue where a bone breaks. And because of this, the bone ends up actually being stronger after it's broken and healed than it was before it was broken. This is a fairly unusual thing. Normally in our bodies, if we damage things, you get scar tissue, and the scar tissue is never quite as good as the original. But in the case of the bones, it's actually better. Okay? At the long end of the bones, where they articulate with other bones, we'll have articular cartilage. And the articular cartilage is going to cover some significant amount of the epiphysis. And that cartilage is going to cover all the way down to pretty close to where the periosteum picks up the bone. Okay, there's the periosteum, and periosteum is going to have blood vessels, both arteries and veins, that it shares with the bone. And we're going to have blood vessels, I already mentioned those. We're going to have rootlets or Sharpie's fibers that connect the periosteum to the shaft of the bone. That stabilizes it so it doesn't move around a lot. And then we have, in this drawing, a callus that I drew in. And there's one on each side here, the callus around there, and then on the outside, there's going to be a callus out there as well. And that callus is like a weld line when you weld two pieces of metal together, and it's going to increase the strength even more of the structure. Okay, so the spongy bone, cancellous bone, it can either be red spongy bone or yellow spongy bone. The yellow spongy bone is going to be storing fat. The red is going to be where red blood cells are produced. And in infants, the red spongy bone is found pretty much in all bones, most of the bones at the very least. But in the adults, the sites where the red blood cells are produced is more limited to the skulls, ribs, sternum, vertebrae, and the ends of the long bones. So here we have a spongy and compact bone. You can see how this really does kind of look like a sponge. And then if you'll remember, I said that there's going to be compact bone surrounding, covering the spongy bone. Okay. Here we're going to see the trabeculi, which means beam. These are part of the red bone marrow, and there are also going to be blood vessels in there. Okay. Excuse me. So spongy bone is going to be formed by the epiphyseal plate. The good news is it's light. The good news is that it's also strong. As I mentioned before, you would think that if something were very light, it might not be very strong. Spongy bone is sort of exceeds expectations. Okay. Compact bone. Compact bone is very dense. It's very hard. It's formed by the periosteum. Okay. And the osteoblasts in the periosteum are the cells that form this bone. And so as the bone gets longer, the bone is also going to increase in diameter. And that's actually pretty essential. Why would that be? Right. As the bone gets longer, the animal gets heavier, and so the bones have to get larger in diameter to support the weight. Okay. There are cylinder shapes, concentric rings of matrix called laminella or laminae, and these are form the osteons when they come all together. And we've got a picture here. So an osteon is this whole piece, okay, and these are concentric rings of the matrix with cells. You can see these are cells here. There's the Haversian canal where the blood goes through, osteocyte, and then these little canals attached to and associated with where the cells are in the lacuna. Those are the canaliculi. Okay. So we got an osteon, Haversian canal, and osteocytes and canaliculi. Now there are two kinds of ossification. There's intramembranous ossification. This occurs between sheets of fibrous connective tissue, for example, between the bones of the skull. And we also have endochondral ossification. Endochondral ossification is the more common type of bone formation. Most bones form this way from basically a cartilaginous matrix that is there first. So you have hyaline cartilage, and that changes eventually into bone. Good example of that would be the sternum. So the sternum is 4 sternebrae surrounded by cartilage and connected by cartilage, but eventually that all becomes one piece. Okay, so periosteum is going to surround the bone. The only place that it doesn't surround the bone is at where the articular cartilage is. It ends there. If you think about it, that's kind of important, because if it were to cover the articular cartilage, then when you move a joint, the periosteum would be worn. Eventually it would tear and be damaged. So because it's not in between the bones, it doesn't experience that kind of wear and tear. This is going to be responsible for appositional growth. Okay. Periosteum is going to be continuous with the ligaments. Ligaments are connective tissue, dense connective tissue connecting bones or bones to cartilage. And it's also going to be continuous with the tendons. And tendons are different from ligaments in that they're also dense connective tissue, but instead of connecting bones to bone or bone to cartilage, they connect the muscles to the bones. Okay. Periosteum is going to have 4 functions, and we'll cover those on the next page. So here we go. Periosteum is going to share its blood supply with the bone. And the bone is alive, so it has to have a blood supply or the cells would die. The tendons from the muscles don't attach to bones, the surface of the bone. Rather, they attach to the periosteum. The periosteum is going to make the bone grow larger in diameter as the bone grows longer. This is accomplished by osteoblasts. I mentioned those before. Remember, they're also responsible for the formation of callus when a bone breaks. And oh my God, that's number 4. Periosteum forms callus on the outside of the bone if it breaks. Endosteum has osteoblasts associated with it, and it forms callus on the inside of the bone after the bone breaks. Okay. So this is a fairly unusual thing. Normally, if you damage tissues and you get healing, you end up with scar tissue, and usually the scar tissue is not as good as the original tissue. In the case of the bones, though, if you get a broken bone, you get callus, and the bone is actually stronger after it's been broken and set than it was before. So if you break a bone a second time after complete healing has occurred, usually the second break will not be in the same place as the original break. Okay. Periosteum is going to be attached to the bone by rootlets. These have a couple of other names. Sometimes they're called collagen fibers. They're proteinaceous fibers, or sometimes they're called Sharpie's fibers. Those are fine. Either one is fine. Okay, so I think most people figure that once you're grown up and you're not growing taller anymore, that your bones are rather static. But that's not actually true. Your bones are being remodeled all the time. It's subtle, it's slow, it's a slow process, but they get remodeled because of stresses that are applied to them. For example, if you run or you stress your bones through exercise, they actually become stronger. And this is a potential problem for astronauts, because when astronauts are in outer space, they're not getting a lot of stress on their bones generally, and the fear is that if they stay in space for long periods of time, their bones will become less and less robust, so that when they come back to the Earth, they will be at a disadvantage, that their bones won't be strong enough to do the kinds of things that they had done before they left. Okay. The osteoclasts are going to be in red bone marrow, and they have the ability to digest the bone. Remember, osteoclasts are also associated with endosteum. So the obvious question is, if you got this matrix, calcium phosphate matrix, how in the world, and it's hard, it's a mineral, how in the world does these osteoclasts make it go away? They don't have teeth, so they can't chew it like Pansy likes to chew her bones. So they have to come up with another way. Does anybody have an idea? Right, acid, very good. And also they have proteinase, some enzymes that are able to digest the fibers, the collagen fibers, proteination fibers in the matrix. Then the calcium, once it's dissolved away from the bone, goes into the blood. And this is a process by which blood calcium can be restored. If your calcium levels drop too much, osteoclasts can digest your bone and release it into the blood. Okay? And we talked about that. Remember, the bones can act as a source for calcium if there's too much in the blood. On the other hand, the osteoblasts make new matrix, and they get their calcium from the blood. So if there's too much calcium, the osteoblasts can lay down new bone matrix on the outside of the bone, and the bone will become larger and stronger. But the more important thing is that the calcium levels in the blood could return toward normal. And these osteoblasts, after they've been making new matrix, eventually get surrounded by the matrix they're making, and at that point they are renamed. They're no longer called osteoblasts, but they're called osteocytes. Okay. So most people would say, well, you know, children need calcium because they're active and their bones are growing and all that sort of stuff, and that's true. The children do need calcium, but it turns out because human adults are also remodeling their bones, they also need calcium as much as children do. Sometimes a condition called osteoporosis develops, especially with advancing age. Again, this can be caused by changes in hormonal levels within the body. And prevention of osteoporosis can be achieved by making sure that the person has adequate amounts of calcium in their diet and that the person is getting adequate amounts of exercise. There are a number of hormones that affect bone growth and remodeling. Parathyroid hormone, which is released by the parathyroid gland, calcitonin from the thyroid gland, and growth hormone. All of these can affect the calcium in the bones. Okay, so just as an example of how much remodeling can be going on, the distal end of the femur can get remodeled every 4 to 6 months. This is because this is an active site of stress for the bone, whereas the shaft may never be replaced. The shaft is not receiving the same amount of stress, and so it tends to be a little bit more stable and less likely to be changed around. Some people get rickets. Rickets, you can see, ends up with deformed bones. Very, very unfortunate state of affairs. And then Paget's disease. This is another abnormality of the bones. You get irregular thickness of the bones, and this usually is caused, here we have Paget's disease, here's a normal person. This is caused because the osteoblasts and the osteoclasts are overactive. Okay, so the skeleton has physical divisions. We have the axial skeleton, including the skull, the vertebrae, the ribs, auditory ossicles, and sternum. And auditory ossicles I would normally classify as just being part of the skull. They are considered, when we do the skull bones, that those include the auditory ossicles, so I don't usually separate them out. Then we have the appendicular skeleton. The appendicular skeleton is going to be the appendages and their girdles. So we have the pectoral appendage and the pectoral girdle. Pectoral girdle made up of two bones, the scapula and the clavicle. And then we have the pelvic appendage or lower appendage and the pelvic girdle. And the pelvic girdle is actually made up of three bones: the ilium, the ischium, and the pubis. The ilium is superior, ischium is inferior, and the pubis is anterior. So let's start with the skull. And what we're going to do is I want you, when we're in class, I'm going to go through an app on the iPad to show you demonstrate all of the bones, and we can talk about their landmarks. I'm just going to kind of go through the list here, but you really would benefit by being in class when I do that lecture in class. So there are two groups of bones. There are the cranial bones, which house the brain, and the facial bones. Facial bones pretty much make up facial features. And one of the bones of the skull is the hyoid. This is the only bone that doesn't articulate with any bones that we have in our body. And it's going to be important in swallowing. When you look at the hyoid, you're going to see that there's a resemblance between the hyoid bone and the mandible. This is not just coincidence. The hyoid and the mandible have common origins, so they come from the gill arches. Okay. Bones are going to be joined by sutures. Sutures aren't completely sealed until you're about 50 years old. They are non-movable joints, but initially there's fibrous periosteum between the bones. Eventually that becomes bone, and the bones do fuse together. So there are going to be four major sinuses in the skull, plus the mastoid sinus. These are grant things. They're named for the bones they're in. So we have frontal sinus, we have a sphenoid sinus, ethmoid sinuses, and maxillary sinuses. That's the four. And then the mastoid sinus, as I said. So sinuses are kind of interesting. When you're born, the sinuses are not really well developed. But by the time you get to adolescence, they're fully developed. And they are air-filled. By being filled with air, they reduce the weight of the skull. And they also have mucous membranes associated with them. And the mucous membranes produce mucus, as you might expect. The mucus has a lot of beneficial functions. It's bactericidal, helps us warm, filter, and moisten the air. And then mucus also is used in the gastrointestinal tract, but the mucal membranes in the nasal cavities are more important in terms of preparing air to enter your lungs. Also, the sinuses act as a resonating chamber for your voice. Now you notice I put this as, this is a function of the sinus. The mucus has functions, but the mucus is not a sinus. It's produced by the sinuses, so that's like a different deal. Okay. So as I mentioned, because they're air-filled, they reduce the weight of the skull. That's always a good thing. Sometimes the four sinuses, not the mastoid, but the other four sinuses are referred to as paranasal sinuses because they're next to or adjacent to the nasal cavities. And as I mentioned earlier, also they're a grant thing, right? So the frontal sinuses in the frontal bone, ethmoid in the ethmoid bone, sphenoid in the sphenoid bone, maxillary in the maxillary bone. Okay. And then the mastoid sinus is part of the temporal bone, part of the mastoid process of the temporal bone, and that's going to drain into the middle ear. Okay. There are four major sutures. The sutures originally were fontanelles. Usually they're closed up mostly by the time a person is 2 years old, although as I mentioned before, the sutures are not completely fused until about 50 years of age. There's a sagittal suture, separates the two parietal bones, and as you might expect, it's in a sagittal plane. There is a coronal suture, separates the frontal and the parietal bones, and as you might expect, it's in a coronal plane. We have a squamosal suture. If you remember, squamous epithelial cells are flat. The squamous suture is flat, and it runs along the margin between the temporal bone and the parietal bones for the most part, and that is a flat surface. And then the last is the lambdoidal suture. Well, Pansy's rolling her eyes at me. So lambdoidal isn't actually how you say it. You say lamboidal, but I say lambdoidal so that you remember there's a D in there. And it's going to be superior to the occipital bone, where the occipital bone articulates or meets the two parietal bones. Lambda in the Greek alphabet, the capital lambda. Sorry about that. Capital lambda looks like an upside down V. So there's a lambda. There's also a lowercase lambda, but that doesn't look like it. It looks more like an upside down Y. Lambdoidal suture is actually named for a famous movie, Silence of the Lambdoidals. Some of you may have seen that. Kind of a scary movie, really. Okay, so we have the bones of the cranium. There's a frontal bone, and there's one frontal bone, although if you look at a fetal skull, and I will try to remember to bring a fetal skull in, fetal skulls start out with two frontal bones. You might ask, what's the deal with the two bones to one bone? Over time, through evolution, the number of bones in our heads as compared with ancestral forms has reduced. So where you have many bones of various sorts and sizes combining into larger bones. And this is one of those cases. It just isn't complete by birth. The frontal bone is going to have sinuses. We talked about that, and I will show you that in the app from the iPad. The frontal bone is considered a bone of the face. It's the only bone that's considered a bone of the cranium and the face. It forms part of the orbit of the eye. And then we have parietal bones. Parietal bones there's one on each side. They don't really have any special landmarks that we're particularly concerned with, but the parietal bones are unusual because they touch all four of the major sutures: coronal anteriorly, sagittal in the middle and superiorly, the squamosal inferiorly and on the sides laterally, and then posteriorly the lambdoidal suture. We have the occipital bone. The occipital bone, and by the way, I didn't mention this, but when we have a parenthesis and a number, it'll either be 1 or 2. If there's a 1, it means there's just one of them, and if there's a 2, it means there are two of them. And the occipital bone is really quite large. It has a foramen magnum as part of it, large opening where the spinal cord originates from the brain. Also, the occipital bone has occipital condyles. The occipital condyles are going to be really important for articulation with the atlas. And that acts like a rocking chair. So when you nod your head yes, your occipital bone and the occipital condyles are rocking back and forth on the atlas, very much like a rocking chair on a floor. The temporal bone, and I should also mention, when you shake your head no, the occipital condyles lock with the atlas. It's a modified tongue and groove joint, and they lock together, and it pivots around the dens of the axis. Temporal bones are on the sides. There's one on each side of the skull, and it has a number of landmarks that you should know. The zygomatic process. Zygomatic process is a posterior part of the zygomatic arch. Zygomatic arch is an important place for muscle attachment. We have the mandibular fossa. So both with the foramina and with some of the other landmarks, such as this one, the landmark or the foramen is not named for the bone it's part of, but rather the bone what is going to be going through it, or what it looks like, or something of that sort. In this case, the mandibular fossa is where the mandibular bone articulates. The zygomatic process of the temporal bone is where it touches the zygomatic bone. It's not part of the zygomatic bone. And then we have the mastoid process. Remember, the mastoid process means it's supposed to resemble a mammary gland. I'm not sure whose. Very unusual looking person, I suspect. And then we have the styloid process. So you may have seen references to a stylus. A stylus is a pen. Styloid process looks sort of like a quill pen made from a feather. Oh, and the reason we have a styloid process, and for that matter the mastoid process, muscle attachment. Muscles pull on the bone grows in response to that pressure. And then we have an external acoustic meatus. And whenever you see the word meatus, it's sort of like a canal. And whenever you see the word canal or meatus, they're different than a simple foramen in that they typically have appreciable depth. The external acoustic meatus is sort of a dead end. So you can't, things don't leave through it or enter for that matter, other than sound waves that come in and interact with our eardrum. The sphenoid bone. Pansy's favorite expression about the sphenoid bone is it's sort of like horse manure. It's everywhere. If you look at it, I think it looks a lot like a bat. I'm sorry, like a moth. If you look into the cranium, I think it looks like one of the big moths, like a Prometheus moth or something like that. Some people say it does look like a bat. I don't think it looks as much like a bat, but whatever. And there's only one of those. We're going to have the sella turcica. Sella turcica is a depression in the sphenoid where the pituitary gland sits. The floor and part of the sides of the cranium are made up of the sphenoid. The sphenoid has a sinuses. The sinuses of the sphenoid are pretty close to the geographic center of your skull. We have the ethmoid bone. Ethmoid bone is about the size and shape of a walnut. There's only one, and it has several parts that are kind of important. We have the crista galli. Translated, that means cock's comb. The cock they're referring to here is a chicken, right? A male. I would say it looks like a sailboat sail. Then we have the cribriform plate. Cribriform plate is where the olfactory foramina exists, where the olfactory nerve goes down into the olfactory organs. And I would say the cribriform plate is like the deck of a sailboat. And then we have the perpendicular plate of the ethmoid. Perpendicular plate of the ethmoid is like the keel of a sailboat. And those of you who are familiar with sailboats, they have keels that extend down in the water to help stabilize them. I think the perpendicular plate looks like a keel. And then the ethmoid sinuses. The ethmoid sinuses are like saddlebags. They sort of straddle on superior lateral to the nasal cavities. We'll see that in the app on the iPad. The ethmoid bone also has a superior and middle concha. So we're going to mention the inferior concha. Inferior concha and the superior and middle concha are these shelves that are sort of curved like a conch shell, hence the name, and they create turbulence when you breathe. That turbulence does a whole bunch of beneficial things. It warms and helps warm and moisten and filter the air, and it also helps with olfaction by getting chemicals that enter your nasal cavity to come in contact with your olfactory organs. Then we have the facial bones. In facial bones we have the maxillary bones or maxilla. There are two of them, one on each side. Not particularly large if you just look at the face. They're between the orbit and the mouth. They have maxillary sinuses that are also between the orbit and the mouth. There are the alveoli and alveolar processes of the maxillary bone where the teeth fit into and are anchored, actually. There's the palatine processes of the maxillary bones. They make up a significant portion of the hard palate, the anterior portion of the hard palate on each side. And the palatine process is another example of something being named for the bone it articulates with rather than the bone it's part of. We have the palatine bones. There are two. They're at the posterior portion of your hard palate. That would be the horizontal plate of the palatine. And there's also a perpendicular plate of the palatine, although we're not going to really do much with that. It goes up on the posterior lateral side of your nasal cavity. Sometimes people have a condition, a birth defect called cleft palate, and this condition is where a person's hard palate hasn't fused, so there's an open space between the mouth and the nasal cavity, and this has impact on the person because they can't form suction because the nasal cavity isn't separated from the mouth. We have the zygomatic bones. These might be referred to as cheekbones on either side. The zygomatic bones have the temporal process, which is the anterior half of the zygomatic arch. Again, that zygomatic arch is an important point for muscle attachment. We have the lacrimal bones. Lacrimal bones are going to be the anterior medial portion of your orbit, and they have a canal running through them, the lacrimal canal, which conducts the lacrimal ducts between the eye and the nasal cavity. So some of you may be aware that if you cry a lot, your nose starts to run, and actually what's coming out of your nose is tears. And then we have the nasal bones. Nasal bones are sort of at what we might consider the bridge of your nose, right about where your glasses would sit if you have glasses. You're very small, by the way. We have the vomer. Vomer is, if you read about it in books, they'll often say it's plow-shaped, but actually I would say it's wedge-shaped, more like a wedge that you would put under a door to keep the door from moving. And it is the inferior portion, bony portion of the nasal septum. There are three parts to the nasal septum. The perpendicular plate of the ethmoid from above. The inferior portion is formed by the vomer, and then the anterior portion is by nasal septal cartilage, which is a hyaline cartilage. We have the inferior nasal concha. These are separate bones that are in the nasal cavity. Okay, and the nasal concha I already mentioned. They're going to increase surface area in the nasal cavities to help modify the air when we breathe it. And again, the modification of the air is going to involve, we'll be talking about this with the respiratory system, but the modification of the air involves warming, moistening, filtering the air. It also has the mucus is bactericidal to reduce the chance that we get infections, and the turbulence created by the concha helps in our olfaction. The mandible. The mandible is another single bone in an adult that is actually two bones in the fetus. When I show you the fetal skull, you'll be able to see that. And it has a strange resemblance, or a strong resemblance, to the hyoid, and I mentioned the hyoid and the mandible both come from gill arches. The ramus is a vertical piece of the mandible, and you'll be able to see that. Fairly small, almost non-existent in a fetal skull, but quite significant in an adult because muscles pull on it and cause it to grow. There are the alveoli and alveolar processes, which are depressions that the teeth fit into. We have a coronoid process. Coronoid process means it's supposed to look like a crown. Personally, I think it looks more like a shark's tooth. That will be at the superior end of the ramus and superior anterior end of the ramus. We have the condyloid process, which is superior posterior part of the ramus, and the condyloid process is where the mandible articulates with the mandibular fossa of the temporal bone. And then we have the body. So the body basically extends anteriorly from the ramus, and that is the part that holds the teeth. Then we have the hyoid bone. I mentioned the hyoid bone before. Remember the seven dwarfs' favorite bone? It doesn't articulate with anything, has a common origin with the mandible. And I didn't mention this before, but the cartilages of the larynx and the trachea also come from those gill arches. Mentioned it does not articulate with any other bone. The only bone in humans that is the case for. And some of the muscles associated with the activity for swallowing attached to the hyoid. And I told you whose favorite bone. Whose favorite bone, Pansy? Right. Seven dwarfs. She likes the seven dwarfs. So the vertebral column. Vertebral column is also part of the axial skeleton. The vertebrae are irregular bones. We saw an example of this earlier. They are separated by intervertebral discs. And the skull is going to be at the superior end of the vertebral column. And it's going to support ribs in the thoracic region. There actually were ribs in all of the regions. In the cervical region, the ribs become part of the transverse process, forming the transverse foramen. The thoracic ribs become quite substantial. The lumbar ribs basically go away, and the sacral ribs become part of the sacrum. The sacrum is going to articulate with a pelvic girdle. Okay, so what does the vertebral column do for us? It houses and protects the spinal cord. That's a big deal. That should probably be red because that's a function. In the adult, there are normally going to be 4 curves. The cervical curve appears between 3 and 4 months. The lumbar curve appears when you're about 1 year old. So here is the cervical curve, the thoracic curve, the lumbar curve, and the sacroiliacoccygeal curve. And the obvious question is, how do these curves get there? Because if you look at an articulated vertebral column that doesn't have discs in, there won't be any curves. And the answer is the discs. The discs are wedge-shaped. They go in between the vertebrae and they cause the curves. So what would be the advantage of the lumbar curve? I will try to demonstrate this for you in class. The lumbar curve really places the articulation between the pelvis and the vertebral column directly over the lower appendage, and this is beneficial in transferring weight to the lower limbs. The advantage of the other curves, mostly for shock absorption. And I'm going to show you a video, and this video will show you shock absorption. This is pretty impressive, I think, actually. Well, let's see if we can bring it up. Here we go. Oh my God. Okay, so we'll play that again, and when I do, I want you to watch the head. Okay, now I'm going to play it again and watch her little feet. So her little feet are going crazy down there, and her head doesn't really bounce around very much at all. And this is largely due to the joints of the lower appendage, but also in part due to the shock absorption capacity of the vertebral column. Okay. Sometimes people have abnormal curves. There are several different kinds. We have lordosis, which is an exaggerated lumbar curve, and kyphosis, which is an overly round thoracic curve. Here you can see kyphosis. And the way I remember that is if you go ka-choo, you bend over with your head, so maybe that'll help you remember the thoracic region. And if you hurt your back, you kind of lean back and put your hands on your back and you go, oh Lord, that hurt. So maybe that will help you remember lordosis and kyphosis. Okay. We also have scoliosis. Scoliosis is a curvature to the lateral side. This person has thoracic scoliosis, and this person has lumbar. So the discs. Discs are made up of 3 parts. There's a nucleus pulposus, which is kind of gloppy stuff in the middle. There is articular cartilage covering the body of the vertebrae. And there's annulus fibrosus. The annulus fibrosus, sometimes called or spelled with 2 N's. Honestly, I don't mind. You can go either way with that. And we see this as kind of a fibrous, impermeable layer. So it contains the nucleus pulposus and prevents it from leaking out. If you dissect the annulus fibrosus, you'll see there are 3 layers. There's an outer layer with fibers going obliquely across. There's a middle layer with fibers going another direction, and then the innermost layer with the fibers going back again. And we've talked about these crisscrossing fibers before, I believe, when we talked about intercostal muscles. Actually, now that I say that, we may not have talked about them yet. We will eventually. Okay. But when you have fibers that crisscross, they're like plywood. And plywood is very much stronger than a conventional lumber of the same thickness and same material, same kind of wood. The discs account for about 25% of the length of the vertebral column. That's a pretty substantial amount. And as one gets older, the nucleus pulposus is gradually going to be reabsorbed. This has sort of several unfortunate consequences. One would be, right, the person gets shorter. Another would be, right, less flexibility. And the other, right, the curves go away. Because remember, the curves are caused by the wedge shape of the discs, and if the discs become deflated, they become less wedge-shaped. So the person becomes less flexible, not as tall, and the curves go away. Okay. So when we talk about this disc, we're going to consider it to be a joint. It's a symphysis joint. Okay, and excuse me. We're going to consider it to be a fibrocartilaginous joint. Now, you should understand that not every book will consider things to be exactly the same way as other books. And so this is what my best interpretation of the facts is. We will consider it to be fibrocartilaginous. Nucleus pulposus is going to act as a shock absorber in addition to causing the disc to be wedge-shaped. And occasionally people damage their discs. They either rupture or herniate the discs. If things get particularly bad, you can remove the discs and fuse the vertebrae together, and this obviously is going to limit how much movement there is there, but it can reduce the amount of pain. The intervertebral foramina are between two vertebrae, and if the discs go away, that foramen becomes smaller, and that can impinge on the spinal nerves coming out of the foramen. So here is a picture of a herniated disc, and you can see this is one of the unfortunate things. The herniation almost always occurs very close to where the nerve is, and the reason that is because this is where it gets the least amount of support. So it pushes on the nerve. So here it's bulging, here it's become herniated, and here it's ruptured with the material leaking out. Okay. Here is the spinous process. This is actually a thoracic vertebra. There's the lamina. The lamina, I like to say, are a little bit like the roof of a house. So here would be the roof, and this would be the wall of the house. That would be the pedicle. Okay. We have the vertebral foramen. What goes through the vertebral foramen? Right, spinal cord. And then we have the body. Okay, and as I mentioned, this is a thoracic vertebra. And I can tell that immediately because of the articulations for the ribs, which we haven't labeled yet, but we will be. Okay. So the vertebral arch is made by the lamina and the pedicle all put together. And it's going to form the wall. There's one wall on each side of the vertebral foramen. And that spinal cord passes through there. Okay. Here we have the transverse process, and you'll notice in the thoracic vertebrae, the transverse process doesn't go out straight like the wings of a glider. It kind of goes posteriorly. And this is because the ribs are pushing on it from the anterior side, and nothing is pushing back. When it grows away from that pressure. There's a transverse costal facet, superior articular facet. This is actually in a coronal plane in the thoracic region. We'll talk about the importance of that. And then we have the superior costal demifacet. A demi means half, and so the head of the rib articulates half of it here and half with the thoracic vertebra superior to this one. Here are lumbar vertebrae. There's the intervertebral foramen, and that's where the spinal nerves are going to exit from the spinal cord. Okay. So if we look at the vertebral column, there are going to be several different areas. The most superior area is the cervical. Cervical is going to have 7 cervical vertebrae. Inferior to that is going to be, right, thoracic. Thoracic is going to have 12. Inferior to that is, right, lumbar. Lumbar is going to have 5, right? Actually scratching the floor 5 times there. And then we have the sacral, which is fused. There are 5 vertebrae. By the way, you might be able to remember these numbers by remembering that you have breakfast at 7, lunch at 12, and dinner at 5. And then we have the coccygeal. Coccygeal vertebrae, when you were an embryo, there are lots of them, like a dog or a cat. But as you develop, most of them go away, and when people are born, typically they have between 3 and 5 of them. The cervical vertebrate characteristics, we have them here. We have a transverse foramen on each side. This actually, this piece right here is the cervical rib, and that cervical rib fuses to the transverse process, forming this opening. That's the vertebral foramen, vertebral artery, and transverse foramen. Apologize for that. Transverse foramen is where the vertebral artery and the vertebral vein pass through. Okay, it has a bifid spinous process, 2 feet, right? And the articulations between the vertebrae are oblique. And this gives us a range of motion with our neck that we wouldn't have with the other areas. And brings us, to the atlas. So the atlas is C1, and it doesn't have any body. If you remember, it wrote that song for David Lee Roth, I Ain't Got No Body. It doesn't have a spinous process, or if it does, is very much reduced. And it articulates superiorly right here with the occipital condyles, and inferiorly it articulates with the dens of the axis. Okay, that is a pivot joint and allows for rotation. So when you rotate your head shaking it back and forth, your axis, your atlas and your skull move as one piece, rotating around the dens. When you shake your head yes, the occipital condyles rock back and forth on the atlas like a rocking chair. It's named for Atlas. Atlas held the world on his shoulders. Atlas was a titan, one of the Greek titans. I think they preceded the Greek gods, and apparently the titans got into this war with the gods, and the gods won. And so Zeus was pretty annoyed with Atlas, who was the leader of the Titans, and he made him hold the world on his shoulders. So I thought that was pretty mean, because the world was probably pretty heavy. But I have a picture here of Atlas holding the world on his shoulders, and you see that when he was holding the world on his shoulders, it was just a couple of wires, and it was really pretty empty. So it wasn't really that big a deal. Also, you can see that Atlas had an 8-pack, which is kind of cool. Okay. Then we have the axis. Axis is C2. The axis is different from all the other vertebrae because instead of having one body, it has 2 bodies. It has this normal body, plus it has the dens, or odontoid process. And the odontoid process, it means it's supposed to resemble a tooth, right? And that's where the atlas revolves around it, or rotates around it. Thoracic vertebrae have some characteristics, so we'll go through those as well. The thoracic vertebrae have articulations with the ribs. There's going to be a superior demifacet, that would be right here. There's going to be an inferior demifacet, that would be right here. And a transverse costal facet, that would be right here. So if this were thoracic 5, the rib 5 would articulate with a superior demifacet and a transverse costal facet of 5. And the head would also articulate with an inferior demifacet of thoracic 4. In addition, the thoracic vertebrae have a long spinous process which points inferiorly. And if you were to look at this from the posterior side, they sort of look like a giraffe. And this is a good thing to remember. You remember all of the giraffes from Jurassic Park. So the thoracic vertebrae look like giraffes from Jurassic Park. Okay. Oh, there it is. There's a giraffe. See? Also, the transverse process is shaped kind of like a V. I pointed that out earlier. And the articulations between adjacent vertebrae are pretty close to a coronal articulation. Lumbar vertebrae, they also have characteristics that are different than the others. One characteristic is it has a short, blunt spinous process, and that points posteriorly, right here. The transverse processes go out like the wings of a glider. Now this one's not quite as extreme as some, but they go out like that. And if you were to cut right through here, you'd have muscle here and muscle here. This would be the bony part of a T-bone steak, if any of you have ever seen a T-bone steak. And then the articulations between them are in sagittal plane, And this sagittal articulation is going to be helpful in tying your shoes. If you want to tie your shoes, your best bet is to bend anteriorly to get down and tie your shoes. We'll talk about the coronal articulation of the thoracic vertebrae in class. That those are beneficial, or at least in theory they would be beneficial for lateral side bending, except we're going to see that that doesn't happen, and you might think about why that would be the case. Sacral vertebrae are unusual because they're all fused, okay? And it's not just 5 fused vertebrae, but also sacral ribs that are part of the sacrum. It's going to articulate laterally with the os coxa. It's going to articulate superiorly with lumbar 5 and inferiorly with coccygeal 1. We have anterior and posterior sacral foramina also. So instead of having the intervertebral foramina going out laterally where the spinal nerves would leave, the spinal nerves leave both anteriorly and posteriorly from the sacrum. Okay, so coccygeal vertebrae. Coccygeal vertebrae are not very well developed in terms of their characteristics. They're very poorly developed, in fact. The inferior most are usually fused. When I first took biology, there were a lot of people saying, oh, the coccyx probably is going to go away because we don't really use it. But in fact, these coccygeal vertebrae, by coming anteriorly like this, sort of form a little bit of a shelf, and that helps prevent prolapse of the pelvic organs. This is going to be the case for males and prepubescent females. In postpubescent females, a lot of times this curve kind of goes away and they straighten out. And that's good news and bad news. Good news would be right birth. Bad news, right prolapse of organs. So mature females can have babies more easily than men or prepubescent females, but they are more prone to organ prolapse. Okay, so it does give support to pelvic organs, both in males and prepubescent females. The thoracic wall. Thoracic wall anteriorly is going to be bounded by the sternum, and then as we move laterally, we get the costal cartilages and the intercostal muscles, and then we come to the ribs and intercostal muscles. Laterally, it's going to be ribs and intercostal muscles. And then posteriorly, we're going to have the vertebrae, the intervertebral discs, and then as we move lateral to that, we're going to have ribs and intercostal muscles. Okay. Inferior boundary of the thoracic cavity is going to be the diaphragm, and diaphragm we're going to talk about more later. Superior boundary of the thoracic cavity is going to be the dome of the neck. So the ribs. There are going to be 3 different kinds of ribs. Total there should be 12 pairs of ribs, or 24. Superiorly we're going to have the true ribs, okay, and then we're going to have false ribs and floating ribs. So this thoracic cage is going to be made up of the vertebrae, the ribs, costal cartilage, and the sternum. And the thoracic cage actually does a couple of things. One is that it protects the thoracic organs. You're going to see that the ribs have a flattened surface. It's not unusual for bones that are protective to have sort of a flattened surface. But in addition, they provide a predictable volume for the lungs and heart in order for them to expand and contract. And so if you could squish your thoracic volume, your lungs and heart wouldn't work very well, and that would usually cause you to be dead. So having a predictable volume is really important for the functioning of the lungs and the heart. Rib 1 is going to articulate with thoracic vertebra 1 posteriorly, and it articulates with the body, and articulates with the transverse costal facet. There is no demifacet for rib 1. Typically, ribs 2 through 9 have the 2 demifacets plus the transverse costal facet. So the rib is going to articulate with a vertebra the same number twice, and it'll articulate with a vertebra superior to it once. And then ribs 10 through 12 just articulate with a vertebra they're numbered for, and not 2 vertebrae. Okay, so the 7 superior groups of 7 superior pairs of ribs are called true ribs or vertebro-sternal ribs, and they articulate directly with the sternum via the costal cartilage. Pairs 8, 9, and 10 are called false ribs, vertebrochondral ribs. They articulate with the costal cartilage of rib 7 anteriorly. And then the floating ribs are pairs 11 and 12. They don't articulate anteriorly at all, although they do tend to have pieces of cartilage covering the ends of the ribs. Okay. Also, try to have a skeleton present when we're doing this lecture so you can see this. The ribs do not go straight across. They slope inferiorly as they proceed anteriorly, so they're kind of going as an oblique angle. And so here we have rib 1, rib 2. This is going to be the right gladiolus, or manubrium or handle. And then this joint right here is the sternal angle or the angle of Louis. Okay, so this is the manubrium, it is not the gladiolus. This is the gladiolus. Pansy's getting me all confused. Okay, so here is the body, or the sternum or gladiolus, made up of 4 sternobrae. And we have the xiphoid process. Xiphoid process starts out cartilaginous and eventually becomes bony as you get older. Usually ends up fusing to the gladiolus or body in older people. Okay, so the body, 4 fused sternobrae. Starts out with cartilage between them, hyaline cartilage, and that cartilage eventually becomes bone. Xiphoid process, remember that's going to be cartilaginous in infants and gradually becomes bony over time. And the sternum is going to help protect the ribs and the heart and the lungs. And that gets us through the first part, skeletal muscular system, on the bones, and there will be a second camtasia that we'll do on the second part of the skeletal muscular system on the bones. There'll be a separate camtasia. I hope you enjoyed this. Pansy needs something to eat. She's all very hungry after all this work. So have a good evening, study really hard, and do the next camtasia if you need, if you miss your class or if you want a little bit extra time.